3D tomosynthesis on specimens was an easy jump for me. We knew the limitations of 2D specimen X-ray, so this filled a niche that was quite apparent.
What we've had in the past is what we would call a two-dimensional X-ray, taking the picture forwards and sideways.
Previously, with the two-dimensional radiograph that we used, you'd have to actually turn the specimen on its side to try to see potentially the superior or the posterior aspect. So now it does save time because you don't have to turn the specimen.
Specimen tomosynthesis allows real-time evaluation of the tissue removed from the breast, and this allows us to look not only in 2 dimensions, but 3 dimensions by taking serial slices through the tumor to evaluate not only the medial and lateral margin, but also the anterior and posterior margin, which allows us to remove less tissue, and therefore, if it's eccentric in the specimen, to just focus the shave. By focusing the margins, we are able to remove less breast tissue, which leads to a better cosmetic result.
With the new machine and the specimen tomosynthesis, utilizing the high quality of the image itself, you can really see the calcifications nicely, and you have a better, secure feeling in your margin status based on the quality of those images.
So it's a tremendously beneficial to the surgeon because I have one shot. I want to get that cancer out today. And to get that cancer out, I don't want to come back tomorrow and have to do another operation. And the tomosynthesis allows me to see it more accurately than if I just have 2 dimensions.
For me, the biggest benefit out of this is a reduction in re-excisions, not just for myself, but for all the surgeons that will utilize the imaging. And it really makes a big difference with patients with dense breast tissue. We are really able to see through that dense tissue so much more. In our center, we provide, as one of our treatment options for radiation, we do intraoperative radiation. And being able to get margins for those patients, negative margins for those patients, is incredibly important.
Adopting this technology actually was fairly straightforward and simple, not hard to learn, and the radiology techs and staff in the room have found this very easy. They're much happier with this.
We feel strongly that specimen tomosynthesis is an integral part of our cancer center, especially in the breast care center, because we're bringing more quality to what we do for our patients.
I believe that the 3D tomosynthesis specimen X-ray is more accurate. It helps us beyond the other generation of 2-dimensional imaging. Good for the patient because if we can be more accurate, of course, it reduces the re-excision rate. But in the operating room, the device we're using now is portable, so it does not have to be sent out of the room. That saves time. Also, the specimen can go into the device to be imaged in front of me, so I know how it's oriented, and I can see within minutes what the results are.
I mean, specimen tomosynthesis is a no-brainer. If you're a breast surgeon and you want to provide the best care, you need this.